From anatomy to anesthesiology, from pathology to pharmacology, from microbiology to medicine, a one-man resource to the world of health sciences. Welcome to Dr. Paul's Medical Lectures. A practicing physician, Dr. Paul offers you essential insights on diseases afflicting millions of people around the world. For today's lecture, here is Dr. Paul.
Thank you very much for tuning this evening to our channel. Today I want to talk a few minutes about third trimester bleeding. You see, the third trimester bleeding in pregnancy, there are many important causes. On the top of the list is abruptio placenta, then placenta previa, then lower genital bleeding, and then coagulopathy. So those are the four most common causes. But always on the top of the list, there are two conditions. They are abruptio placenta and placenta previa. So those two causes are very, very important. Whenever you see a patient in a third trimester bleeding, a pregnant woman in third trimester bleeding, that's a grave emergency. If you do not treat them, they might die, and it's a dangerous condition to both the mother and the baby inside her uterus. So there are two things here, the life of the mother and the life of the baby inside her uterus. So both of those lives can be engendered if we endangered if we neglect this. So let us talk about placental abruption, that is abruptio placenta. So it's basically when the placenta separates from the uterus. So the blood supply, the supply to the fetus has been disrupted. So as it separates, there will be blood accumulating between the placenta and the uterine wall. And that blood trickles down and appears as vaginal bleeding. And that causes very severe abdominal pain to the mother. So when you think of the risk factors for this condition are smoking, hypertension, multiparity, and sometimes trauma to the abdomen, and cocaine use and previous abruption. And when you see uterine tenderness, vaginal bleeding, or when a pregnant woman is complaining of abdominal pain, or there is a sudden increase of contractions, then whenever you see that hemorrhage, then your lights should go off. Should immediately think of that. Okay. And some of these patients will go into disseminated intravascular coagulation, shock, and die. Then the second condition is placenta previa. Basically, the placenta is implanted in some lower section of the uterus. It usually causes painless bleeding, and the bleeding will be smaller amounts, and it is observed for shorter periods. But do not neglect it, because the small blood loss can give a false sense of security, and it may eventually result in a sudden massive hemorrhage and resulting in the death of the baby and the mother. So the placenta previa, whenever there is increased parity, increased maternal age, multiple gestations, or previous C-section or abortions, the patient has a high risk of placenta previa. Then the third cause, the coagulation disorders. It's an uncommon cause, but certainly it plays a role in many women. So whenever you see these patients, you should think of coagulation problems and do some coagulation studies. Now, how do you treat these patients? When you see a woman with third trimester bleeding, you should immediately call for obstetric evaluation. These women develop hypovolemia and hypotension. And when you see these hypotension, hypovolemia, immediately start giving blood or crystalloid. So insert a large bore like 16 gauge intravenous catheter and start giving, like draw the blood for CBC, and coagulation studies do pro-time and thromboplastin time, fibrinogen and platelet count. Those coagulation studies type and cross match and prepare the blood and go for the test. So you draw the blood and you start the infusion, and use ABCs, basically, that those ABCs are important even here. And then you also see for toxicology. Remember, as I said, many women with abruptio placenta will use cocaine. So do a urinalysis and urine toxicology study in these women, and put a urinary catheter and draw some urine for urinary tract infections, and do an ultrasound. You see, ultrasound helps to determine the placental location. So whether the placenta has been separated from the uterine wall, or whether the placenta is implanted in some abnormal location like the os. So ultrasound determines the location of the placenta, but you should never delay taking care of the patient because of the need to do the ultrasound. So when you see this woman, hospitalize the patient immediately to rule out the cause for the third trimester bleeding, and do not examine them in the emergency room. For example, you are an emergency doctor and the patient comes to the emergency room complaining of third trimester bleeding, and then don't do a speculum examination in the emergency room, because you see, they might get a massive bleeding and bleed to death. So you should always take them to a delivery room and in the vicinity of an operating table, because if the mother gets a massive bleeding, that results in fatal bradycardia, and that can endanger the life of the mother and the life of the baby inside her womb. So whenever you see these people with these pregnant women with bleeding, you should always keep them near operation theater, because in case you have to take the patient immediately to the operation theater and do C-section and deliver the baby. So that is the most important aspects of third trimester bleeding. Remember the causes. Remember, it's the seriousness. It's a very serious medical emergency. Remember the causes, the top 4 causes: placental abruption and placenta previa, and coagulation problems, and lower genital bleeding like from vagina or cervical wall. That's also possible. But on the top of the list are 2 things. Number 1, placental abruption, when the placenta separates from the wall of the uterine and starts to have that subplacental hemorrhage, dribbles out of the vagina. And then the placenta previa, when the placenta attaches to an abnormal location in the uterus and causing a painless bleed, and which could result in a massive bleeding if neglected. So when you see these women, you take some diagnostic studies like type 1 cross match, and coagulation studies like PT, PTT, fibrinogen, and the platelet count, and then you type 1 cross match for immediate blood transfusion, and if there is a need, and if the patient has hypotension or bleeding, you immediately start a large IV bore needle and giving them the transfusion. And also you monitor the well-being of the fetus, and if the fetus develop bradycardia, you should immediately take the patient to an operation theater and do C-section. So those are the important points about third trimester bleeding in pregnancy. If you have any important points, please feel
Thanks for listening. For more medical videos, please visit us at www.drpaul.org and take time to browse through hundreds of health videos we regularly post on our site. If you are preparing for USMLE, PLAB, and other medical exams, make sure you visit our website to browse through our videos explaining the essential points you need to know before taking these examinations. For more information, visit us at www.drpaul.org. Thank you, and may God richly bless you. Are you preparing for USMLE? Please do not waste thousands of dollars on training courses. Get the books written by Dr. Paul with the student-to-student tips and memory aids. The success will be yours, and you will soon realize your dream of becoming a physician in the United States. If you are preparing for Step 2 clinical skills, study USMLE Smasher, a guide helping thousands of medical students to pass this examination. For more information, visit us at www.drpaul.org.